This is the first chapter of the textbook. It's pretty straightforward. It's pretty easy. Again, I'm not going to go into detail on every single slide that was provided. I'm just going to hit the high points, okay? And make sure you go back through the chapter mastery quizzes and make sure you understand what the quizzes are asking you. So again, this is an introductory course, okay? So we're going to introduce you into the healthcare system. The textbook is fairly useful at building your theoretical knowledge. So that's all this really is. And this first chapter is pretty self-explanatory, pretty straightforward. And like I said, I'm going to hit the high points. Okay. After reading the chapter, I'm sure you understand. I'm sure everybody understands, especially at the college level, being that everybody is educated. Okay. Why is healthcare important? We know why it's important. Okay. It takes care of the sick and try to get them well. And then it's also a system that takes people that are supposed to be in good health and tries to give them the tools and the resources to make sure that they stay in good health over the course of their lifetime. Recently, in a down economy, the healthcare sector hasn't really shrunk. It has continued to be a very, very expensive sector. And at times it also, when other parts of the economy have stalled, the healthcare sector has grown. So not only is the healthcare sector important in keeping healthy people healthy and trying to get sick people better, it's also a major employer within the United States. The healthcare sector is also a source of innovation. Okay, there's a lot of innovation that happens within healthcare in terms of pharmaceuticals, right? I mean, nowadays you can get a pill for just about anything, right? It's a source for technology, MRIs, CAT scans, ultrasound machines, um, gamma knife, radiation, right? A lot, very, very technology heavy medical treatment and diagnostics, but it's also a source of innovation for information systems. Whether or not we use them correctly is a different story, but the technology is there. And we'll get to that actually towards the end of the class about information systems. The thing to take away from this, and I touched upon it in the introduction lecture, is that the cost of healthcare is rising. In order to compare the United States healthcare system to other healthcare systems across the globe, you have to compare apples to apples. You can't just look at how much a healthcare system or a country spends as a total. You got to look at it, like I said, in apples to apples. So a common measure of how we do that is comparing national GDPs, or gross domestic product. What that means is that if you look over here in 2009, in the U.S., the gross domestic product, I don't know why it keeps doing that. In 2009, GDP of what we spent in the entire United States towards healthcare was about $2.5 trillion, or 17.6%. So that means is that in 2009, about $18 out of every $100 in the US of everything that we spent as a country, 18 out of every $100 was spent on healthcare. And so you can go across the globe and you can look at other countries and what they spend on GDP. And that's a good measure of how much do we spend compared to Japan, compared to Australia, compared to England. Okay, so GDP is a good way to compare apples to apples when you're talking about how much how much resources does a country spend towards healthcare. A couple of characteristics within our healthcare system is surprisingly is the number of hospitals in the U.S. healthcare system is decreasing. Okay, hospitals are shutting down, not at a record high pace, but hospitals are shutting down nonetheless as a whole. And if you look at this graphic right here, It's rural hospitals, hospitals that are out in rural settings. It's expensive to keep a hospital open. And what you'll find out is that in rural settings, a lot of Medicare and Medicaid patients go to rural hospitals. And a lot of uncompensated care in emergency departments is in rural hospitals. A lot of private insurance is located in urban settings and uses urban hospitals. And we'll get into why that matters as we work through the course. But just keep in mind, as a whole, hospitals and the amount of beds, hospital beds available in the U.S. is decreasing. What's happening is in hospitals places, in the place of hospitals, is outpatient centers are on the rise, right? Dialysis centers, outpatient orthopedic surgical centers. Like, for example, you look in Jacksonville, the Jacksonville Orthopedic Institute, JOI, or even Heekin Orthopedics, okay? Where, say, a knee surgery, knee replacement, hip replacement surgery used to be a service that you would admit somebody to the hospital and they would stay there for maybe a day or two. Now it's an outpatient service. You go at 6 a.m., you're under the knife at 7 or 8, and then you're home that afternoon, assuming that there's, your vitals are fine, which 99% of the time they are. So you're not being admitted to the hospital because it's much less expensive to operate on somebody and get them home that day instead of admitting them into the hospital. Hospitals are very expensive, and we'll get into more of that in chapters, I think, 3 and 4. Some major issues that are concerning our healthcare system right now is that the quality of care, there's a big difference in whatever your type of insurance that you have. There's a big quality of care difference. If you look at health outcomes for people, for patients that have private health insurance through the workplace, right? Blue Cross and Blue Shield, Aetna, HMOs, PPOs type of plans, and we'll get to that stuff. Don't worry about it for right now. But the purpose of this slide right here is that the quality of care that somebody that has private insurance versus the quality of care that somebody gets if they have Medicaid is very different. And that's what we have to improve on in the U.S. And here's some other issues of major concern in the United States healthcare system. Costs are increasing at an unbelievable rate. Our public healthcare system needs to improve. And chronic disease is really on the rise. That's where this one comes into play. It's unhealthy behaviors, right? High fatty diets, fast food diets, sedentary lifestyles, right? All contributing to diabetes, obesity, cardiovascular disease. And chronic disease is a real big issue in the healthcare system currently. But different people in the healthcare system or different stakeholders have different concerns. Well, who are the stakeholders? Stakeholders meaning who are the people in the United States that have a vested interest in the performance of the healthcare system. And there's all sorts of different healthcare stakeholders, right? Patients and taxpayers. Patients, or another way to put that is consumers. I don't really like to use that. Consumers, it's patients. But whenever you hear consumers, it's the same thing. Those that consume healthcare services. They're a big stakeholder in the U.S. healthcare system. If I'm sick, I want to get in to see a doctor. And more than that, I want to get in to see a doctor that knows what they're doing, that doesn't have a lot of malpractice claims against them. Healthcare professionals are a stakeholder, right? Doctors, nurses, physical therapists. Healthcare institutions, such as hospitals, outpatient centers, medical schools, those facilities and those professionals all have a vested interest in how the healthcare system performs, right? Government, pharmaceutical industries, insurance industries, these are all stakeholders within the U.S. healthcare system. Different stakeholders have different interests, right? Why does a patient care about the healthcare system? Well, they just want to get better, right? I want quality care. versus a physician may want to have equitable distribution of funds, right? They want to get paid a fair amount. Government wants to see efficiency healthcare to cut down on errors and to cut down on wasteful spending. Same thing with insurance companies. Okay, so different stakeholders within the US healthcare system have different interests and have different issues with the healthcare system. Where you're going to come into play, especially for those that want to go on into healthcare administration, is getting all the stakeholders on the same page. Where can we make improvements in the healthcare system to make it as an overall better industry, to bring costs down, to bring quality of care up, and to bring access to quality of care up? There shouldn't be a big care discrepancy between somebody that has a sprained ankle and has Medicaid insurance and somebody that sees a doctor for a sprained ankle that has private health insurance. Yeah, they should get the same type of care, but unfortunately they don't. And where you live matters as well. A Medicaid patient in Florida should get the same quality of care that a Medicaid patient does in New York. Okay, these are just discussion questions. You can go back in here and look at those. And then the second part of the chapter talks about, there's a lot of different charts in there, okay? Know the industries, all right, and what they do, the governmental industries, such as the Department of Health and Human Services. Who are they? What do they do? Okay. They oversaw the rollout of the healthcare exchanges through the Affordable Health Care Act, and what a absolute disaster that was last year, 2 years ago. Different government agencies. Where you live matters. Geographically, socioeconomic status, right? Where you live, how many hospital beds per 1,000 residents or populace, right? And the green has a higher higher density, right? This one right here talks about how many physicians per resident. So based upon population size, how many doctors are in these different states? Okay. Midwest and Northeast versus, right? I guess you would call that the Midwest as well. And then the South. Big difference. And the book gets into that a little bit. Per capita expenditure. That's a measurement you need to be familiar with. Per capita expenditure is a healthcare measurement that measures the average healthcare expense per person during a given time period. So, for example, this one's talking about 2004, which, of course, I mean, at this point, I told you that the book is a little bit outdated. You know, we're talking about 10 years ago. So, if you look at, let's say, New York right here. Okay, New York, that's green down here. So per capita expenditure, if you take the amount of healthcare costs that New York spent in 2004 through the whole state, right? You take that total and then you divide that by the population size, how many people live in the state of New York, you'll get a per capita expenditure. Okay, and we'll talk about that more in class. It might be a little bit difficult to visualize over a recorded lecture. But it's a way to, again, to compare apples to apples. What states spend the most per person? What states spend the least per person on healthcare? Okay, and it's a good way to sort of compare. And this website right here, statehealthfacts.org, good website to use. It's a good resource. Okay. We'll get into that as well. That's a healthy living metric. And we'll get into that. You can read that in the textbook. This right here, this is one that we're going to stop and talk about for a second. It's called looking at employees within the workforce, within the healthcare system workforce. Okay. According to the U.S. labor Bureau of Labor Statistics, the job growth in the healthcare system is going to increase. It's going to keep increasing. There's a shortage of workers in certain sectors within the healthcare system. And then other sectors and other professions within the healthcare system are expected to grow over the next 10 years, especially as baby boomers age into Medicare and age into retirement. There are certain sectors within the healthcare system that are going to have a higher demand, a higher need for employees. Physician assistants is one. All right, look at that. It's expected to change. The expected need for PAs and physicians assistants. It's expected to grow 41% by 2018. I thought healthcare administrators was in the professions. Management, business, financial occupations, that's going to increase. As a whole, the healthcare sector, the amount of employees, the workforce, is going to increase by almost a quarter. So a lot of jobs on the horizon in the healthcare industry. Okay, pretty easy chapter, pretty self-explanatory. I think the mastery quiz is literally 5 questions. Should be relatively easy for you to find the answers to those questions. So give the chapter a skim. There's really nothing major in here that is difficult to grasp or understand. If it is, reach out to me and let me know. And that did not record.